It seems like people are still filing in, but I think it's probably good for us to get started sooner rather than later. Hello everyone. Thank you so much for coming to our program director and residency leadership panel. We are the New York Emergency Medicine Student Council, also known as the NYEMSC. We are an organization that is dedicated to getting out sort of emergency medicine learning and programming, and just trying to connect medical students and those interested in going into emergency medicine with opportunities to either learn more about the specialty or what the specialty can offer, and just the path to get to becoming an emergency medicine physician in general. Um, so without further ado, I would like to introduce our board. Hi, everybody. I should have introduced myself. I am Brendan. I am the chair for, oh, I forgot to change the year. This is 2025 to 26. Um, Alora is our vice chair. Our lovely social media coordinators, Priscilla and John, created the flyer that a lot of you probably scanned to get here, and they created the social media posts that many of you probably saw that brought you here. Um, Garrett and Brian are our advocacy and policy directors. They are sort of putting together some programming for this year related to how you can advocate for health policies with your local government, and things of that nature. And then for our liaisons, we have Cornelia, who is our IMG liaison, coming or helping us out all the way from Italy. And then we have our liaisons for New York. So we have Jason for upstate and Western New York. We have Marc for New York City, and we have Robert down on Long Island. And they have been doing a wonderful job making sure that we could get connected with all of the emergency medicine interest groups that many of you probably heard about this event from. So big thanks to all of them for the work that they've done so far and all of the work that we're going to do together this year. Um, so we have a big schedule, so time is sort of the essence. But as is sort of our custom for this panel, we are going to move across the state roughly north to south and west to east. We're going to start all the way up in Rochester, and then we're going to end on Long Island at Bayshore. Just some quick ground rules. Camera's optional. If you want them on, great. If you don't, that's fine too. But please make sure your microphones are off just so we're not distracting our panelists. As I mentioned, we kind of have a lot to get through, so we don't want to be distracting anybody as they are speaking. Um, and then panelists, you're all going to have about 4 minutes. And Garrett, also shout out to Garrett, who is one of our veterans on the board who's going to be helping me moderate. He will be sending you little like 1 minute warnings. So just try and keep to the 4 minute allotment just so that we can keep things moving and that we have time to both hear all the programs and get some questions answered that the attendees have. And then attendees, hold your questions, please, until the end. But once we get to the end and we're getting to the Q&A section, please feel free to drop whatever questions you have in the chat. The only reason I say wait until the end is because a lot of times the panelists will drop their emails in the chat, and your question will very likely get lost in all of that if you ask it too early. So save it for the end. I have questions that we got from the forum, and Garrett will also be looking through any questions that seem like they're relevant to a lot of people in the chat. So if we can get to your question, we're going to try and get to your questions, and if we can, we'll ask them. Um, and then yeah, and just try and keep the questions broad that many or most, or just a good chunk of our attendees could benefit from. So don't ask specific programs. Like I said, a lot of them will be dropping their information. So you'll be able to probably ask them directly. Without further ado, I'm getting to my 4 minute introduction mark. So Dr. DeAngelis, feel free to kick us off and talk about Rochester.
Oh boy, I get to go first, all the way out in Western New York. Hi everyone. Thank you very much for coming to this today. So I have the joy to talk about Rochester, New York, which is a program I will be honest, I did not know much about when I started. I grew up in the Troy, Albany area, and when I came out here, I absolutely fell in love with the area and with the people and with the program. And so I'm really glad to tell you a little bit about it. So, one of the biggest advantages of our program is that we are sort of the only game in town. It's kind of a little bit about what all of the I-90 programs have, is that we cover these huge catchment areas. And so we get all of these different presentations from, the same stuff that you'd see in any fairly large city to, people getting like run over by cows and stuff. So it's like really interesting, and you get to see a lot of different stuff from all the way from the Pennsylvania border all the way up to, Lake Ontario. We are a fairly sizable department. We have a lot of visits and a lot of subspecialty care. We're the only real level one trauma center for peds and adult and burn in the like general area. So we get a lot of business. We do a lot of things like ECMO and LVAD and transplant, which is sort of on that. Um, we have a very devoted faculty with a very diverse set of people who teach, our subspecialty tracks, our fellowship programs, and we've sent our graduates sort of all over the place. Some of the things about Rochester that I really love and would have kept me here for a long time is one, the city has a lot more to offer than you would expect because of the University of Rochester's sort of like expansion into, other things like art and the Eastman School of Music. And so we have all of this great culture in the city from theater and music, etc. We have festivals galore in the summertime, and it's a very accessible city. So, having lived in Boston for a while, I remember like having to plan ahead for 2 weeks to get anything, to get reservations or tickets to anything. And in Rochester, you can really just kind of like decide you want to do something, and then you can go do it. And for some of the students who might be, further down south in the city, your residency salary and your money goes a lot farther out here. Things are a lot cheaper. The standard of living for our residents is pretty high, and they get to do a lot of great things. That is mostly the things I wanted to touch on. And I think I want to make sure that we stay on time and have time for everyone else. But we'd love to see you out here in Rochester. Consider us when you apply, and or if you want to do rotations, and come out and see us.
All right. Thank you so much, Dr. DeAngelis. And next up, we have Upstate, Dr. Campoli.
Hi, thanks for having me. I have two slides. This first one has two QR codes. One is our residency website, where you can find more about our program and about Upstate, the region, and the hospital system. And the other is the residence Instagram, where you can find out the serious things we do at Didactics and the fun things that the residents get up to socially. So if you would like to take a screenshot of those. The other thing on this slide is just to tell you that we are a well-established program. We've been around for quite a while. And then you can go to my next slide, which is where all the information is. I am the program director. We are a 3-year program. We currently have 12 residents, a class. We just got up from 11 to 12, and we are hoping to go up to 14 a class. We, very similar to what you just heard in Rochester, we're the only show in town, the only academic medical center, level 1 trauma center from the Pennsylvania to the Canadian border. We have a PEDS-ED, we have a PICU, burn center. We are a stroke center. One thing that's really great about us is our toxicology. We have the only poison control center in all of upstate New York. You get great tox training here. We do have a geriatric emergency department as well. We also have many fellowships, which you can come and do a fellowship, but you can also benefit from all those fellows who will teach you while you're here. We have a medium-sized city, great cost of living, which is super helpful when you are a resident, and you will have no competition for your training while you're here. The great thing about, I think the best thing about Upstate is the culture. We have a family atmosphere. We have a supportive atmosphere. I did my residency here. and I stayed 20 years later. I think that's my best endorsement of the program. We will be doing hybrid interviews this year, but we'll have in-person socials and second looks. So if you're interested in Upstate, you can certainly come do a rotation. You can come to an in-person social. You can come to a second look. So hopefully you will consider us. And I just put some facts on here about the university itself, about how many visits we have per year, the fact that you'll get to rotate at our community campus, our PEDS-ED, our VA, and our other hospitals that are in town as well. I put my email on there if you want to contact me with any further information. And I thank you for having me.
All right, thank you so much. Moving on to Albany Medical Center, Dr. Gillespie.
Thanks so much. I appreciate you guys having me out. And at the risk of sounding a lot like the last two, I'm going to change it up a little bit because in a lot of ways we are fairly similar size. You know, some things that I would tell you about our program is that I've loved. You know, I moved from Oregon. I grew up in Oregon. I did med school in Oregon Health Sciences, and I came out here for residency with no idea really at all anything about Albany or the area, with the thought that I was going to leave immediately after. But I graduated residency in 2019, and here I am still in the same shop. So I certainly think it's a great place to be. I don't have to sit in traffic at all to get to the hospital. My longest commute has been like circling the parking garage until I got an attending badge. But you know, the two things that are a little bit different perhaps than some other places is how well we're represented within the hospital hierarchy. Our CEO is an emergency medicine doctor. Our head of GME is an emergency medicine doctor. Or excuse me, our assistant GME is an emergency medicine doctor. You know, on and on throughout the hospital system. And then, you know, similar to what the last two were saying, you know, we really get a broad variety. So I was trying to figure out what to say the other day. And when I'm a nocturnist, I was working an overnight shift, and one of the residents in the PEDS-ED, I happened to be the adult ED, was telling me about some patients. And I realized I was just going to capture a couple of things that happened during one 8-hour overnight shift. So in the PEDS-ED, he said that he got a whole taste of all of New York, the state of New York. He had a 13-day-old Amish kid who was born at home, who had no shots and had a fever. He had a couple of rich people from Manhattan that came up with a 3-year-old with Stridor because they were up at a camp, and a Jewish Orthodox family also with a kid from camp. They had somebody with Lyme disease and a 13-month-old with a pretty significant scalp laceration that was repaired in the ED. On the same shift, I had, you know, a level 1 trauma that was intubated with hemorrhagic shock, who had a pretty significant brain injury, got a bolt in the ED, and went up to the SICU. I had 2 sedations with shoulder reductions. I had a STEMI activation that a second-year resident was taking the call from the REMO organization and talking with the EMS to organize that. We had an older gal come in with some failure to thrive who happened to have, unfortunately, some maggots in her wounds and a tear duct abscess. And we had a gal with abdominal pain that she'd had for a few months and had got a ventral hernia repair to try and solve this a couple months back, but it wasn't helping. And it turned out she had a whole belly full of metastases and carcinomatosis. So, and then, you know, a host of other things that I didn't bother to write down. But this is a, you know, a one kind of overnight shift at 8 hours in the department. So pretty good mix of things. You know, I put my email up there in the chat. Please feel free to email me at any time, and I'll cut it short so we can keep moving.
All right. Thank you so much, Dr. Gillespie. Finishing it up for our upstate programs, we have Vassar Brothers. Dr. Borenstein, go ahead.
I have to unmute myself. Sorry. So I've got just a few minutes. I want to try to emphasize some of what we have as strengths and some of what I feel is a little bit perhaps more unique. These are a few pictures. Sometimes a picture can say 1,000 words. And I just wanted to give you a sense of the Hudson Valley, Vassar Brothers Hospital, but mostly I want you to get a sense of the residents that we have here. We have a distinctive culture with a great range of diversity and representation. Particularly, we have a representation of residents who come from groups historically underrepresented in medicine, and probably have 40 to 45% of our program in that category. If you just go to the next slide for me, this is kind of a little bit of why train with us. Well, many of these things you could find at other programs as well. We have a high acuity, diverse patient population. We are a level 2 ACS trauma center, helicopter, ground EMS. We have a lot of the things that you will find at other programs: procedural experience, tremendous POCUS education. We have great resources, residents, program faculty. And you can find out more about that on the website itself. And on the Instagram, you can see about some of our social activities. But if you take us to the next slide, this is the part I really want to focus on a little bit more. Because what we've built here over a relatively short time, we opened in January 20, is a program culture that I think is very distinctive. And I encourage you to get to know the program cultures where you interview. It's difficult sometimes in this age of internet and not being there in person and everything virtual. But to the extent you can find a place where you feel at home, I think that's really important. You're going to find many of the resources that programs have are fairly similar. We all have to meet a lot of standards that are very high. And thankfully, we're able to do that. Emergency medicine, I think we can be very proud of the standards that we've set for training. But we serve our communities and our patients. They are our raison d'etre. We value the unique contribution of every resident. We are here to take team to a level that you are not just here, and I am not here, and we are not here for self alone. We are here for a sense of purpose driven by contribution to community. And we are here for one another in that sense. So when you come to conference, it's not just a conference like a class in college. It's like your presence makes a difference, and your absences, we're not the same team without you. And every person matters, every patient matters, every staff member. And we coach to take that team to the next level. We're interested in people who really want to be their best, who want to come in and deliver their best. And we want to create a foundation on which you can stand for the next 30 years. I've been doing this for over 35 years. I'm not burned out yet, and I'm not planning to be. I know what it takes to go the long haul, and I want to teach that and role model that for our residents in this program, and I think our faculty does the same. We want to take communication and create master of communication. Everyone's going to be a master of the airway, and that's what we strive for. But if you can become a master of communication, where you can connect to people you've never met before under difficult circumstances, who are in pain, who are worried, who are frightened, who may have had a prior bad experience, who've been stereotyped, labeled. If you can connect to those people and let them know that you care, you're going to have a very different life in emergency medicine than a person who does not have those kind of communication skills. And I believe they can be taught. And I've been spending most of my career in the last 20 years working on that. So we want to create effective communication between team members, with patients, with everybody, and so that you can use communication to even prevent burnout, which is something that I think is incredibly important. That's why we don't want words like sickler. We don't want frequent flyer. We don't want drug seeker. I don't want to hear it. I don't even like denies, claims, admits, poor historian, non-compliant. I could go on and on. I want to remove those words from our vocabulary because they don't support us. They don't help us create a positive, loving relationship. And I think at the heart of everything, it's love. Love is the greatest healing energy, and we want to have you stay in touch with that and have it strengthened during your residency, not lost. That's what we're all about.
All right. Thank you so much, Dr. Borenstein.
Thank you.
Moving on, kicking us off from New York City, Dr. Domingues for Lincoln.
Hi, everybody. Thanks for joining us tonight. It's a pleasure being here, guys, meeting some of you guys. My name is Roy Domingues. I'm program director here at Lincoln in the Bronx. You could go to my next slide. Those are all my information's on. We've been around since early 1970s. We are the busiest ED in New York City, actually in New York. We're the third busiest single site ER in the country. We see our 170,000 ED visits per year. That's our low average. Our numbers keep going up. 32% pediatrics. We have a 10 to 12% admission rate. And about 2% of those 2% of all patient visits tend to be critical care. We are level 1 trauma center. We see significant amount of trauma in the South Bronx. Most of it always is usually blunt, but we do get a lot of penetrating trauma. We have pretty much a 1-to-1 faculty ratio to resident ratio. We've hired 10 new attendings this past year. That literally makes it a 1-to-1 ratio. So we have lots of fellowship trained attendings in almost every single fellowship. We have graduates that go to every single fellowship across the country. We have graduates all over the country. It's when I trained at Lincoln. I've been here for 15 years. Love working here. And I don't see myself leaving. My background, I'm Canadian. I don't anticipate ever going to go back to Canada. I'll probably stay at Lincoln until I retire. Interviews this year, we're going to do mostly virtual interviews, just to save expenses and costs. We will do in-person second looks. If anybody wants to come to New York City and come visit, spend a day, half a day, you're welcome to come. Socials, we're doing both virtual and in-person socials. Everybody that interviews with us will have access to all those socials, and those socials are only with those. Will be just with residents. There will be no attendings there, so it's a free for all. Ask what you want. That's what the residents are going to provide you all the information needed. Alrighty, I'll put my email down below. Feel free to contact me for any questions or any concerns.
All right. Thank you so much, Dr. Domingues. And now for Jacobi and Montefiore, Dr. Restivo.
Hey, everybody. Thank you for having me today. I'm actually the new PD for our program. That transition just happened about 7 weeks ago, but I've been an APD for Jacobi, and I trained at Jacobi, so I've been there now almost 17 years. I'm just going to talk a little bit about the different sites that you guys will rotate through should you join our residency. Jacobi is our home site. It's a level 1 adult trauma center, level 2 pediatric trauma center. It does have high volume, about 130,000 patients per year. We are a burn and hyperbaric center. We're also a snakebite center, STEMI center, and now we are a stroke center. Next slide. The other site that we're affiliated with is Montefiore. There's 2 separate sites for Montefiore. There's Montefiore Moses and Montefiore Weiler. So Monte is also a high volume site. It's a tertiary care center. They are number 1 in the heart transplant based on the US News and World Report rankings. They're also an LVAD, STEMI center, and a comprehensive stroke center. And they also have a nationally recognized children's hospital, which you spend some time in during your residency. Next slide. The other Montefiore division that you'll spend some time in, which is where I primarily worked as an APD, is Weiler. It's a medium volume site, more like a community site in the setting that, or in the sense that you guys will actually see peds and adults in the same space. They do have structural heart, which is a specialized division of cardiology. They are also a STEMI and stroke center. In addition to the 3 sites that you rotate through, there is also a pediatric department at Jacobi, in addition to the CHAM pediatric site at Montefiore. We are also, we have a number of fellowships, including administration, research. We have a trauma fellowship, critical care, pediatrics, simulation, and ultrasound. We're working on developing a tox and global health fellowship. In addition, our simulation division is a fairly regular part of our curriculum here. So we have a couple of interesting, actually really cool simulation events planned coming up. One is a tox escape room coming up next month, which is a Grand Rounds collaboration with Harlem Hospital. In addition, we have the Army coming mid-September to perform a large MCI event with our Jacobi ED folks. And it's roughly 100 to 150 patients. They'll actually come on site and build the resources that you would need to triage and appropriately take care of that volume of patients. We did that activity about 4 or 5 years ago, and it was such a wild success that we're going to repeat it again coming up. I will put my email in the chat. If you guys are interested in more information, we'd love to rotate with us or like to rotate with us, just shoot me an email, and I'd be happy to set something up. And hopefully to see some of you at ASAP if you're going to ASAP at the residency fair table. Otherwise, looking forward to hearing from some of you.
All right, Dr. Restivo, thank you so much. Now representing my very own home program, Dr. Lech, please go ahead.
Thank you, Brandon, and thank you to the rest of the team for having me this evening. So I'm going to just briefly chat about our residency program, and as the other PDs and APDs did, I'll leave my information in the chat as well at the end. Can go to the next slide. So first, we're just going to briefly meet our team. I think really when we talk about our program, it's really about the people that are in it. So our residency leadership team, our residents, and of course our patients. So at each site, we have an associate program director and then 2 assistant program directors. Is really the OG of our group. He's been with the program since it started, and at Columbia even longer. So he's our associate PD at the Columbia site. We have Trudy Cloyd and Emogene Morley. Emogene's transitioning out of her role to move closer to home and family. And we have a new APD at the Columbia site, Vinay Sagar, who we're really happy and excited to have step into the role. And then at our Cornell site, we have Janelle Lambert, Chris Reisig. Janelle was a chief resident when I was at my prior shop, my medical education fellow, and now really excited that she's in our residency leadership group as well. Go to the next slide. And then we have our vice chairs of education. So Tiffany Morano on the Columbia side and Kaushal Shah, who I am sure a lot of this group knows on the Cornell side. Tiffany is also one of our assistant DIOs in the GME office. Go to the next slide. And as you can tell from the intro slide, we mainly focus on 2 campuses, the Cornell, which is on the Upper East Side of Manhattan, and Columbia, which is in the Washington Heights neighborhood. And so with these 2 hospitals, very high volumes, about 100K plus per year, and also different patient mixes. Cornell is literally across the street from Memorial Sloan Kettering, so we have a lot of complex patients with cancer that we see. Every shift I work, I feel like I learn something new about like the newest therapy for certain malignancies. We also have a burn center at Cornell, so we get a lot of patients with very minor burns to more severe burns. Both sites, but particularly Columbia, have a very robust ECMO program. So rotating through Columbia, we'll get a lot of experience in that area. Go to the next slide. So some benefits that I want to share, which I think is like a great bottom line for residents, especially if, some of the feedback or concerns that we get coming to Manhattan, cost of living, or transitioning from, a place that's not Manhattan. So I wanted to share some benefits, and this is really fresh off the presses from our GME office. So the resident salary was increased recently, and I believe we have the highest salary in the country for our residents. And yes, this does take into account, obviously, like cost of living is a little bit different compared to some other places, but we're really excited and really proud that that was advocated for by our GME folks. The other things that we get, lift credits. We have shuttles between the sites, but this is also something to supplement when you're coming off like late, odd hours, on shifts. We want to make sure people get places comfortably and safely. We also have this living supplement, other reimbursements for, licenses, things like that, which is pretty standard. The residents get a meal card. Oftentimes they're have so much left over at the end of the month, they like get everyone on the team like something on their shift to use up the funding that they have. And then this is new. They get essentially just part of your paycheck, an extra $1,000 that, should be used for academic and scholarly pursuits. And then this is just the salaries, but we can go past this since we talked about this. And I'll just close with some new things that we've added to our curriculum. So we have a new community ED experience at these 2 NYP affiliated hospital sites, Lower Manhattan, which is right by where the World Trade Center was, downtown, and then Westchester Medical Center, another level 1 trauma. And this is really just to supplement the residents' experience in that of like a community experience. So thinking about transferring patients, having limited resources, et cetera. The nice thing about these sites is that, and I could speak to Lower Manhattan in particular, there's really no competition for procedures. I think that's a concern that comes up of other residents, consultants, kind of taking or, being deferred to get procedures. There are no residents, there's only APPs on the consulting service. So you want the procedure, it's yours. You're managing the reduction, you're managing the chest tube, the line, all of those things. We also added research block, and we've expanded our electives to some new local electives and also a bunch of international electives that our residents have gone to. And then I'll just leave this here. I know I'm going over time, but just some wellness offerings. We have some wellness opportunities that for community building that we fund, some through like our residency leadership group and then through our residency and GME funds and peer support programs. And that should be it. If you want to just check out the residency Instagram, you can just scan this or search the old-fashioned way. And again, I'll leave my information in the chat. It was great to present to you all, and I hope to hear from all of you and see all of you during interview season.
All right, Dr. Lech, thank you so much. Next, we have for Staten Island, Dr. Rudnan.
Hello. Yes, thank you for having me. I'm Simona Rudnan. I am the clerkship director and the co-ultrasound division director for Staten Island. So Staten Island University Hospital is located in one of the 5 boroughs. One of what makes us pretty special is that we are actually the lushest of the boroughs. So we span about 13 miles long, and we take care of a patient population of about 500,000. On Staten Island, we have 3 hospitals, 2 of which we cover, our North Site and our Princess Bay Site. Our North Site is where most of the time the residents spend. This is our academic tertiary care center, our level 1 trauma, our burn, STEMI, comprehensive stroke. And on the other side of the island, we have our community site where, again, you get to work with the same residents and attendings. We see about 100,000 at our north and about 30,000 at our south site. We are a 3-year residency program with 10 residents per year. So this means you'll never feel lost in the crowd. You'll always be supported. You have strong mentorship with your little sib and big sibs. You have an attending mentor. And you have this strong camaraderie of a tight-knit team, but with the resources of a major academic center. One of the features that truly sets our program apart is our commitment to procedural training, from central lines and chest tubes and advanced airway management. So to support this, we have a dedicated 1-month procedure team rotation in your PGY 3-year, which was established by our program director a couple years ago to focus on just doing procedures. So you get consulted from the inpatient team to do procedures on the floor. Our emphasis extends to ultrasound, where our residents master both basic and advanced applications ranging from nerve blocks to TE training. And to share this experience more broadly, we produce concise, high-yield videos on our website in a series called Sono in Staten. And in the spirit of innovation, we've also gone a step forward to create a fully equipped podcasting studio where we record our podcast called Only in Staten. And we have a lot of great people who help with this podcast, along with Dr. Swami Nathan. Our conferences are also really dynamic and engaging. They use blended case-based learning, evidence-based learning, simulation, and interactive sessions. We are a competitive bunch, so we like to do various competitions, whether it be residents versus battling attendings or our residents battling other residencies for our conferences. Beyond residency training, we support your growth with various different fellowships that we offer, including administration, education, global health, and ultrasound. Next slide. Oh, okay. Never mind. Thought there was another one. That's fine. Our program isn't really about the curriculum, but it's about the people. Our residents, what make this program truly special, they bring that energy, the humor, and the drive and the heart that makes Staten Island emergency medicine such a family, alongside our nurses and ancillary staff. But if you want to see what we're all about, you can absolutely look at our Instagram at SIUHEM Residency. I'll put that in the chat along with my email address. So if you're ever interested in coming to check us out, just let us know. Thanks.
All right. Thank you so much, Dr. Rudnan. For Maimonides, Dr. Lee, go ahead.
Hi, everyone. Thanks so much for having me. I'm pretty stoked to be here to tell you about the Maimonides EM residency program and to share the stage with so many great educators from all the New York programs. So the MIMO EM program, it's a 3 years, 18 residence a year. We're a pretty well-established program. We've been around for over 2 decades now. We are located in Borough Park, Brooklyn. It's a neighborhood that's at the intersection of a lot of diverse and different communities. And so I think the patient diversity was a big draw for me. I think it's a real privilege to be able to take care of like such a diverse and vulnerable patient population. Like a lot of the programs tonight, we're a pretty high volume, high acuity type of place. We are level 1 adult trauma, currently level 2 peds trauma. We're like a comprehensive stroke, STEMI, all of those things. And I think one of the most rewarding things for me working in a place like this is to be able to provide really such comprehensive medical care to a patient population that actually otherwise wouldn't have access to it. It's a pretty exciting time for Maimonides Health right now. We're actually opening a new children's hospital that includes a brand new state-of-the-art pediatric emergency department. We also have a new psych ED. We also have 2 other sites now. We have a community site, Maimonides Midwood in South Brooklyn, as well as a freestanding ED in Bay Ridge, also a little further down south in Brooklyn. All of these new clinical sites, all of these new EDs, they also pose a really great opportunity for our residents because they all actually rotate in all of these places. And I think it provides them an opportunity in residency to really learn, what the full gamut of emergency medicine could look like. Our residents come from all over, West Coast, Midwest, East Coast, locally in New York City, and everywhere in between. We're a pretty big hospital, big program now, but we retain, one of the things I really like is that we still really retain like that small family feel, camaraderie. Let's see, what are some of the highlights that my residents would want me to highlight for you guys? Our residents working at various events at MSG that includes like sporting stuff, music stuff. I think there was a Lady Gaga concert recently that there's stiff competition for who got to work that one. They also cover a lot of music festivals. I know the Gorge out west is a popular one. I know I myself, I've also done Burning Man. So some of the attendings will also, for the bigger ones, go work with the residents. The US Open recently is a popular one that we also cover every year. And I think all of this is, obviously a nice way for residents to make a bit of additional change during residency, but it's also really like very a great way to kind of practice emergency medicine and learn a few things as well. We are a 3-year program that also has a dedicated international rotation. It's 1 month long in the 3rd year. We have several well-established sites that include Taiwan, Barcelona, London, and for the past 2 years, also base camp at Mount Everest. So with all of this exposure, I'd say for the last couple of years, probably 2/3 of my residents have gone on to fellowship and, they've gotten jobs, both academic community, really at like a lot of great places all across the country. So I don't want to run over. So I would encourage you guys to reach out to us. Our website is at mimoem.org. Our Instagram is at the same, at mimoem. I'm happy to talk with any one of you guys. I know all of my residents and anyone else from our med ed team would be as well. So I look forward to meeting a lot of you guys out there on the interview trail. Thank you.
All right, thank you so much. Next up, we have downstate in Kings County. Dr. Schechter, go ahead.
Hi, good evening, everybody. My name is Josh Schechter. I'm the Combined Emergency Medicine Internal Medicine Program Director, and as well as an Emergency Medicine APD. And talking about Kings County, downstate, also in the middle of Brooklyn, we are actually located smack dab in the middle of central Brooklyn. Our residency started in 1995, so we've been doing this 30 years now. And we really kind of pride ourselves on our academic training and clinical training that we provide for our trainees. Our main teaching sites are SUNY Downstate, which is a state-run hospital, and directly across the street from that is Kings County Hospital. Kings County is certainly our primary site. It's ACS certified level 1 trauma center. It's a classic county hospital vibe and feel. We see over 140,000 patients there. It's a stroke center, and it's busy. And through that volume, we really achieve amazing clinical training. Some of our other smaller sites that our residents get slightly different experience at is the VA. That could be either Brooklyn or Manhattan, depending on the rotation, and the Mount Sinai Brooklyn, also more of a smaller community experience, which we just added this year, which we're getting pretty good feedback from the residents for. We really pride ourselves on the people in our program. That's kind of what makes every program, is the people. And we have a really diverse group of residents and faculty. And what's amazing about them is their dedication to our patients. And a big part of our mission is service. So we serve a community that is heavily underserved, and that's a big part of who we are and how we identify, is serving in that community, where a lot of times they're coming into the emergency department because they really don't have any place else to go. No other options, and what happens is that sometimes patients come in a lot sicker than they need to be, or sometimes they come in not sick just because they have no place else to go. Sometimes they get off the plane and come directly to us, like the day before they were someplace very, very far away, and the doctor told them to go to Kings County Hospital, and that's kind of what we're about, and we're very proud of the clinical training we provide, but we also provide academics with that. We have our really great weekly conference that is diverse in all sorts of different ways, whether it's case-based learning or split curriculum, where we have very often we split up the juniors and the seniors, because sometimes senior residents sitting through a talk is a little bit too simple for them, and sometimes advanced topics might be too advanced for our interns. So we'll split up juniors and seniors, and maybe do some oral style board review for our third years, and career preparation for our fourth year residents, and understanding that different learners can't always just sit in the same room learning the same stuff. In terms of other academics, obviously we have fellowships in ultrasound, administration, disaster, global health, pediatrics. Another interesting experience is our observation unit. Kings County had the first observation within the New York City hospital system, public hospital system, and all of our residents rotate through the observation unit as a senior resident, and it's a unique opportunity, because observation has become kind of ubiquitous, and understanding the slight differences between just seeing a patient for 6 hours in the emergency department versus their management over the course of 24 hours is a really great experience for our residents. And in terms of like what our residents do in terms of career opportunities, there's a lot. We have a lot of grads who are going into fellowships that run the gamut from wilderness medicine to disaster medicine to ultrasound to emergency medicine, cardiology, EMS. The list goes on. You guys know all the emergency medicine fellowships, and our grads have done pretty much all of them over the years. They're also doing academic careers, their leadership throughout the country, and as well as working in communities, and some doing the locums thing. Let's see what else. In terms of just the clinical experience is kind of what we're all about, and that's why next slide, our website is clinicalmonsters.com. So we're open about who we are and what we think of ourselves, and I think we've been doing it for 30 years. Check out our Twitter and Instagram, which are right there. That QR code will take you to our Clinical Monster website. There's information there for applicants, and I'm going to share my email in the chat. And if anybody has any questions, please don't hesitate to reach out. Certainly, if you have any questions about our combined emergency medicine, internal medicine program, I'd be happy to answer those as well. Or you can reach out for just questions about our categorical EM program. Thanks.
All right, thank you so much. Next we have also in Brooklyn, Wyckoff Heights, Dr. Manganiello. Go ahead.
Hi everyone, I'm Lynn Manganello. I'm the APD for Wyckoff Heights Medical Center. We're located in the Bushwick neighborhood of Brooklyn. Um, we're a community hospital center. We have multiple different residency programs as well, so a little bit different than some of the other programs we've heard from today. But I do think that our community site offers some kind of unique experiences. Um, so we are very busy. We have about 80,000 patients per year. We're one site for ED rotation. So you would do all your ED rotations through our primary site, which I think is an awesome opportunity because all of our faculty get to know each and every one of our residents very well and on a personal basis, and we can give you a lot of very particular feedback amongst working with you so frequently. It also gives an opportunity for everyone to get very close. We only have 6 residents per class, so total 18 residents. So everyone kind of bonds and knows each other well. We have a pretty robust also um, like social schedule where you get wellness days and we all kind of hang out in the area. Um, as far as being in the community, so we're not a trauma center, however, still being in an urban center, we do see a lot of traumas. So sometimes we'll get like walk-in gunshot wounds or people dropped off, or perhaps we're the closest hospital to an MVC. We've seen a lot of different trauma patients come in, and then the ED is it. So we kind of take control and run everything from anything from your trauma resuscitations to orthopedics to just your regular medical resuscitations. We are it, and we kind of own our ED. So it's a really awesome place. We have a very robust uh, our residents come from a lot of different locations throughout the country, and our residents actually live throughout New York City, Long Island, and New Jersey. So most of them do live in Bushwick, which is a really fun neighborhood. There's lots to do. You can walk to the hospital, but we have very good public transportation where you could get to the hospital from anywhere. Um, we see really interesting patients as well. We have a lot of immigrants who come to the hospital to seek medical care. So we see some really interesting things, anywhere from diagnosing malaria, multiple cases I've seen of cutaneous leishmaniasis, which I never thought I would ever see. So really interesting over there. So it's a really awesome place. We're going to be doing virtual interviews this year, but we will offer in-person second looks. So anyone that's interested, please don't hesitate to reach out. I put my email on the slide. I'll also put it in the chat. And then also follow our Instagram. We're going to be posting a lot of things around interview season so you can get to know more about the day in the life of our residents. Thanks.
All right, thank you so much. Now representing our last borough in New York City, we have New York Presbyterian Queens.
Hi, I am Anita Louie. I am the Associate Program Director at York-Presbyterian Queens. I just wanted to point out our Instagram here as well, NYPQ EM, and our blog, which is quacktalk.org. That's more for you to get to know us, to see how we are on an academic level and on a personal level. Next slide, please. So I'm the associate program director. We have David Simon, who is our assistant program director. Currently, our program director, Solma Parikh, had a tragic loss in the family, so is taking a little bit of a leave, but hopefully we'll be back soon. We are a 3-year accredited program. We have 10 residents per year. We actually just recently had an increase. We are affiliated with Weill Cornell Medical College. And like Dr. Lech said, right, we have the perks that come with it, right? Very competitive salary, full benefits, monthly meal stipend, commuter stipend, housing stipend, free hospital parking, paid memberships to all of the organizations that are part of EM. We, pay for our residents to go to national conferences. Our first years get to go to New York ASAP, second years get to go to SAEM, and our third years get to go to ASAP. essentially. We see about over 100,000 patients a year, and we're continuing to grow. We are a blend of like an academic program given our Weill Cornell affiliation, but we are still in the community. We are in Queens. Queens is actually the most ethnically diverse county in the continental United States. So you can see that we really see like a lot of different patients of different backgrounds, both socioeconomically and ethnically as well. There's like 120 languages spoken here. We are the receiving hospital for the US Open now and for Citi Field. So that's home of the New York Mets. And there's also various concerts that kind of go through Citi Field. And also, of course, LaGuardia Airport is in Flushing Meadows or in that area. We are a level 1 trauma center, a stroke center, STEMI center. We do have a separate pediatric ED that we do longitudinally. And one of the things that I'm most proud of at York-Presbyterian Queens is our simulation program. We do sim every single week for Wednesday didactics, whether it is one-to-one, where we really cater your education towards your needs and wants. Afternoon sim and group sim. We have over 10, 11 faculty that are dedicated towards kinesthetic learning, right? Because we don't want really death by PowerPoint anymore, right? So that's a QR code to check out our website. I'm going to drop my email as well. So thank you so much for having us.
All right, thank you. And now kicking it off for Long Island, representing Zucker and Northwell Health, Dr. Pereira.
I am so excited to get a chance to talk to you soon-to-be doctors. It is amazing that you will be the next generation that absolutely changes emergency medicine. It is going to be a hugely fun thing to watch. I'm from Zucker Emergency Medicine at North Shore and LIJ. We are a 3-year multi-site system with Northwell. There are actually 22 hospital emergency departments that are available to us. We mainly hang out in 3 of them, each one about 100,000. We benefit, as the previous person just said, from one of them being in Queens, where you have the amazing patient diversity as well as the amazing food that goes with that. And the other one is on Long Island. It gives you a little bit of a different population. One is a major level 1 trauma center with a huge number of hits and receiving. It is interesting to me how much Long Islanders hate each other. So you absolutely get good trauma on Long Island. But one of our philosophies is that we wanted to create a program that would have everything that, well, we would have wanted when we were going through residency. So one of the things that we decided was it was probably worthwhile not just doing trauma at our level 1 emergency medicine department, but also going down to shock trauma for at least a month to see what it's like in an area where they hate each other even more than they do on Long Island. And that theme is a big part of what we try to have. Can you go to the next slide? So if you are going to get trained and you're going to go learn how to be a woodsman, they're going to give you a knife. They're going to send you into the woods. And I think you're going to hear a lot of these programs seem to have a lot of those amazing things. But there is a difference. Can you go to the next slide? If I were going into the woods, this is the instrument I would want. I would want to go to a program that gave me every available tool so that I could have a career in anything. There's a really nice study that says that if a program has a fellowship in something, residents in that program get a better education in whatever that is. And we took that to heart. Go to the next slide. We have a fellowship in everything. And we have an immense amount of didactic sessions available if the residents want it in almost every topic. And we really believe that as you consider your career, you should have tried every aspect of emergency medicine to try to become, I don't know, the best doc you can be. All of our sites are incredibly high acuity. We actually have 8 of our attendings who spend half their time in the ICUs, and we are blessed by that because not only does that speak to our high acuity, but it also means that when you rotate up in the ICUs, you are going to be working with your own docs. And there's something so comfortable about working with an ER doc in the unit that makes it so that you integrate with the hospital so well. And that's the other piece of our residency. It's a really nice place to work. People are nice to you. And the group of residents we have is just so amazing. Go to the last slide. We really want to train you to be the absolute best. And how that's going to work is you have to live in a place you like, work with people you like, and you really are going to become the best doc you can be. So I'll drop my my email up in the thing. Thank you so much for listening.
All right. Thank you, Dr. Pereira. And now we have NYU Long Island, Dr. Ortego.
Hi, good evening, everybody. My name is Alexandra Ortego. I'm the PD at NYU Long Island. It's really great being here with all of you today, and thank you for taking the time to come and learn about all these great different programs. So our program is located in Mineola, New York. It's on Long Island, just over the border from Queens. So like was mentioned before, because of that location, we have a lot of great patients from a lot of different areas, from Queens, from out further east on Long Island, a lot of socioeconomic, language, cultural diversity. We are a ACS Level 1 trauma center, stroke center, STEMI receiving hospital, and we're a big academic center, so we have pretty much every subspecialty service you could imagine. And we have a very sick patient population. So our admission rate's over 30%, which is very high. Our residents are in our critical care bay from day one of residency, taking care of sick patients. We have our own pediatric ED, so our residents get a nice longitudinal pediatric experience throughout their 3 years with us. And our department is also very involved in our medical school, so our residents have lots of teaching opportunities and access to all the benefits of our medical school. We also send residents out to our community site, NYU Langone, Suffolk, for 4 months of their residency. And I think this is one of the highlights of our program because it is a true community experience. There's very few trainees in that hospital. It is a busy, high acuity community site. So our residents are running, level 1s and level 2 traumas out there, and they're the only trainee in the trauma, and they have access to those procedures, and they're making decisions about whether or not to push TNK on stroke alerts. So it's been a really big highlight for our residents. We are a smaller program, or 3-year program, and we have 6 residents per year. So it is a very small, tight-knit community in the residency, but also amongst the faculty. So our faculty know our residents really well. They get a lot of individualized attention. And I think that people really like to spend a lot of time together, both inside and outside the hospital, and celebrate the major life events together. I think part of that is fostered. We have a unique seating structure in our ED where all the doctors, regardless of what team you're on, kind of sit together in one big area. So you always know what is going on the other teams and getting pulled into interesting cases as a resident. We are also a newer program, so we're graduating our first class this year. And so our residents have had a very unique opportunity so far to help us build the culture and the experience in our program. Their feedback and ideas are really taken very seriously. And they've had this opportunity to really build a legacy and make new inroads within the program. So if that's something that's interesting to you, I really invite you to check us out. I'll also drop my email in the chat. I put our Instagram and website information down there too, and I hope to see a lot of you during interview season. Thank you.
All right, thank you, Dr. Ortego. And next up, we have Good Samaritan Hospital.
So, hi guys, good evening. So, I'm Steve Sattler. I'm the Associate Program Director at Good Samaritan in West Islip, New York. So, for those of you not familiar, West Islip is just over the Suffolk County border. This evening, we've been slowly moving farther and farther east. For those of you looking for a program in the middle of New York or in the inner city, we're not quite what you're looking for. But those of you who like densely populated suburbia, where you can see some trees and a green park and the water, but also get all the food you want and all the good times you want. We're kind of like the sweet spot, I like to think. Um, Being where we are, we're very lucky for our training. We really have an extremely diverse population where if you weren't from Long Island, you might not believe that, but our catchment area is about 1.2 million people. To our west is a very super affluent area. To our northeast is Fight and Gun Club, exactly what you would think of the more indentified parts of Long Island. So what makes our program unique? Well, we are a 1, 2, 3 program. We take 10 residents a year. We've been doing this for now 21 years. We are very well established in our hospital and sort of considered, the residency program of our hospital that people go to and rely on the most. In the time that I've been at our hospital, it went from a large, busy, but community hospital to something that's much closer to a true tertiary care hospital and is now the centerpiece of the Catholic health system. We're a level 1 trauma center, comprehensive stroke center, pediatric center, bariatric center, STEMI center, you name it, we got it. We have all the major subspecialties and a million of the little ones as well. We have our emergency medicine residency program. We have an observation fellowship, an ultrasound fellowship, and we have an ACGME approved pediatric emergency medicine fellowship. So the point I'm getting at is we're a busy place. We see 90 to 100,000 patients a year. We have a lot of patients to be seen who are super sick with all excellent opportunities for training, just like most of the programs that you were introduced to tonight. So what makes us unique? Well, like I said, we take 10 residents a year, and I think 10 is kind of our sweet spot where everybody is an individual. Everybody gets, to know the attendings and the residents back and forth very well. But it's enough that, you have some classmates, you have people who are going to become your friends for the rest of your life. We like to think we have a very family feel to our program. I think the students who come to rotate with us and then the residents who stay with us really see that. We speak to the residents who have graduated our programs going all the way back, all 20 years. We get some of them to come back and lecture, and we enjoy seeing them at national conventions. It really, once you come to our place, you sort of stay there for good. Um, like I said, we have a very community feel. We have one-on-one resident to attending interactions, so you're not lost in the woods. You're really spending time learning directly with your attending, seeing a boatload of patients because we're very busy. We have all the bells and whistles of a usual ACGME program. I think one of the things that is slightly unique for our program is every year one of our residents goes somewhere. And what I mean by that is everyone goes to a conference, a national conference every year of their training program, which really contributes a lot to the home feel of the program is going away with your classmates and your attendings. This year, the 1s and 3s will be coming with us to ASEP in a week or two, and the second years are going to SAEM. So if this sounds like fun to you, I'm going to put our Instagram and our website in the chat. I'll put my email after that. Anybody's more than welcome to reach out to me at any time. Just, see, we have VSLO, we have everything you need to get into our program. And if you find that it's blocked or it's not the right time for you, just call MedEd. We can almost always go over cap just to squeeze people in who are interested in emergency medicine. So whether you're a medical student or you're looking to apply, I strongly recommend that you consider Good Sam. Come on out and check us out.
All right. Thank you, Dr. Sattler. And oops, here's everything else. And last but not least, we have South Shore Hospital.
Hi, everybody. I'm Andrew Massantuono. I'm the APD here at South Shore Hospital. Thanks for sticking with us to the end. Happy to be the last program. We are, as the name suggests, we are on the South Shore of Long Island. We are, I guess, the easternmost program that's being discussed here today as well, just over that Nassau County border. If you want to go to the next slide. We are a tertiary care academic center. We see about 85,000 patients per year. And in addition to being a level 1 trauma center and a stroke center and a STEMI center, we're the receiving hospital for all of Northwell Health's eastern region. So every community hospital in the eastern region of Northwell Health, they have that complex critical care emergency department patient that can't be handled in their hospital, it gets transferred to us. And we have basically every specialty available to us that can help us with that patient. So you get to see some really cool sick patients in our ED. We have a pretty high pediatric acuity as well. We don't have a separate peds ED. We see our peds patients alongside our adult patients, but we are very commonly intubating, resuscitating, coding pediatric patients, unfortunately. But again, a good pediatric experience in our ED. And we are suburban as well, as most of the Long Island programs are. But I have worked in plenty of New York City EDs, and I know the diversity that comes with the patient population in New York City EDs. And for some reason, where we are, you get that. In every sense of the definition of diversity, we have that in our patient population. So if that's something you're looking for, but you don't want to live in that big city environment, you kind of want the more suburban lifestyle, this is definitely that kind of place for you. The next slide. A little bit about our program. We're 3 years as well as most of the programs you've met here tonight are, and with 6 residents per year. Our first class started in 2019, so we're not new, but we're kind of young. We have a lot of mentorship available because we're that smaller sized program. So whether you're in a fast track shift, a critical care resus shift, or just a main ED shift, you're pretty much always one-on-one with your attending. So it leads to a lot of great relationship building with your faculty. We have a great Feminem chapter as well, which is very active again for that mentorship abilities. And we have a nationally renowned wellness director. She lectures on the national and international actually circuit for wellness. So we take it very seriously to make sure that you're being successful not just at work but outside of work as well. Being a part of Northwell Health means we have access to every benefit that Northwell has, which is competitive salary, great benefits for your health care and retirement, but also a lot of opportunities for electives and network building. Remember, when you graduate, you're going to need a job. Northwell has tons of EDs. So being able to secure employment afterwards, I think, is one of those great benefits. We also send our residents to national conferences. Last year, our third years went to SAEM, where they competed in the Sim Wars and the Sauna Wars, and they presented a couple of posters. So we were very proud of them for that. We do have educational stipends. We give you access for free to, Rosh Review, Peer, EKG Weekly, and a bunch of other subscription services to make sure you have the tools that you need for your education style and to really be successful and learn what you need to learn. Our shifts are a mix of 12 hours, 8 hours, 10 hours, just to give you a little bit of variety. So it's not just that 12-hour rut continuously. And we do have the goal of giving you at least 2 weekends off per block. Again, trying to make sure we maximize that outside of work and inside of work balance. We know that a lot of our graduates will go out there and not work in tertiary care hospitals and work in more community EDs. So we do have a community hospital rotation. We do that our second year and our third year. And even though we have a lot of sick kids in our ED, we recognize the benefit of having PEM faculty educate you as well. So we do have our residents rotate at Cohen's Children's Medical Center, which is our pediatric hospital with Northwell Health. So you do that a couple of times throughout your training as well. But besides that, you pretty much stay with us. So we're not having you travel all throughout the tri-state area or Long Island just to kind of get your rotations in. We keep you local, which I think our residents appreciate to not travel too much. One last slide. We'll show you if you are interested in coming to check us out. We have a lot of opportunities for our students. You can come to sub-Is. We have wilderness medicine electives, ultrasound electives, resuscitation electives, medical education electives, whatever you want. Or you just want to come shadow us for the day and come check us out. That's totally fine. You can scan the QR code here. That will bring you to our website where you can learn more about us. Or that's our email address. I'll put my email address in the chat as well. And thank you all for sticking with us to the end here. I appreciate it.
All right, thank you. All right, so that concludes the first part of our panel tonight. And just a plug for NYEMSC before I drop off of the PowerPoint. If you want to check out our website, if you have questions for us, feel free to reach out. You can follow. I actually don't know if we're that active on Twitter anymore, but it still exists. We still have our Instagram that we are active on. So yeah, let us know if you have any questions about anything. But for now, we are going to go to our Q&A portion. So let me just grab our questions. All right. So rather than also any panelist program leadership, if you have to go, that's fine. But if you're willing to stick around for the next 30 minutes or so to answer any questions, we would very much appreciate any insights that you have. So I'm gonna go through sort of the what I found to be the questions that are going to be the most useful to the most people from the form everyone filled out to come here. And then I'm not going to be prescriptive about like, hey, can you answer this? Can you answer this? I'll probably ask for like maybe one or two representatives, any panelists who feel that they have insights, and I trust you all to make space for each other. So I'm going to start with just a couple of questions that I think are probably answerable without the panelists, and anybody speak up if you think that I am off base. But a couple questions that came in. So one of them, a couple people asked, does EM residency require a specific type of letter other than the slow, and how many slows are required for EM? My understanding, and please anyone chime in if I'm wrong on this. Slows are what is necessary. Narrative letters are good but not necessary. Do we agree? Okay, thank you. And then for the second part of that question, how many slows? So my understanding is also ideally at least two slows in total. If you have a home program, you do at least one, you do your home and at least one away. If your school does not have a home program, then you do two aways. Do we have any objections, additions? Okay, thank you. And then uh, next question is, what is the timeline for EM transitioning to being exclusively four-year programs? I believe that is the case that the fourth years who are applying now are the last year that will have three-year programs, and then it will all be 4 year. Is that correct? No? Okay, so please, anybody, what's going on?
The ACGME just put it off again.
Yeah, they put it off till 2029, and it'll give us a lot more time to talk about it. So it's going to be just sort of a watch and wait at this point.
Okay. That was new to me, so thank you so much for that clarification. Okay, so one question, especially with and for this one, this has to do with geographic signaling. So if anybody who can share, if it would, I would appreciate if we could have one upstate Western, one New York City, and one Long Island person, whoever would like to share. Since we're sort of in new territory and it's sort of the Wild West with the new geographic signaling model for residency casts. For those of you who at the pan or for those of you attending who don't know, now rather than having like the Mid-Atlantic as your geographic signal for I want to go from New York all the way down to like some of the more southern states, you would say you have to like pick a city and say that this is where I have my ties. Um, so given the change in how signaling works now, um, how would you see how would you as program leadership consider geographic signals that are like in your region but not the city that you're in, or if they're in a neighboring state? How are you looking at those compared to how you would look at like a mid-Atlantic signal before? And in addition, do all programs see a person or an applicant's geographic preference, or is it just the programs that are like in that city or near that city? And anyone who would like to share from any region to get us started.
I can say I think it's hard because I think some of you might be applying broadly, and so we understand that there are a lot of factors that go into that, like family and all of those things. I think as long as you are able somewhere in the application to kind of articulate and make that connection of like I want to go to X place for this reason, it's okay. We know that like we don't want you to feel like I'm so limited and therefore like it's a detriment to have put something and I'm going somewhere else. But I think again, if you can make that connection of like, I have a good social network here for this reason, or I completed a lot of like schooling and so I have a social network that way. We understand we're not going to hold it against you.
Yeah, I find it's very difficult to kind of interpret because you could start the interview season with a particular view, and then you find a program, you interview there, you kind of fall in love with it in some ways, and you may have not signaled, to be before the interview season started, but you can express your interest. I'm not quite sure how to anybody who's interested who has a good application is going to be considered strongly. I don't know where to put signals sometimes.
Yeah, I mean, at Rochester, we try really hard not to get too much into the sort of game of signaling in general. We make it very clear when people interview with us too, like we don't expect or even want like thank you notes. We don't necessarily want signals. Like we just want good candidates who want to come and interview, and that's really where people kind of like let us know, like, is it something where you're interested in coming somewhere new, or is it that you have a strong support system here? And we just kind of we all try to get a sense of each other, and you pick what you want, we pick as best we can, and we try really hard not to play a lot of these games. So I don't think the geographic signaling is super strongly gonna affect what you do.
All right, thank you. Um, all right, moving on to our next question. So sort of similar, on sort of a similar vein, but we can also make it more specific. So the question was, how important is it that an out-of-state student does a rotation in New York or at your program? So it sounds like, I mean, I think we have an idea of the New York answer, from the prior answers to the previous question. But in general, if anybody can answer, how important is it that someone does a rotation at your program? How much can that help? Or just your perspective on, EM programs in general. How much does that matter for our field that you went to this hospital in terms of matching at this hospital?
Yeah, I mean, we so for Lincoln in the Bronx, just that signaling too. It's hard to know what to do with signaling. Um, we kind of prefer people reach out to us directly and tell us they're interested in our program and why they want to come here instead of signaling. But the signaling thing is a gamemanship thing. It's something that we've never put a lot of emphasis on. But concerning rotations themselves, as long as you rotate it in the New York area kind of thing, and then you're showing interest, you don't have to rotate with us to match with us. You don't have to come for a second look even. But if you've shown interest, you have some type of social ties in the area that will support you during residency. That goes a longer way, I think, for us than anything else.
Yeah, I'll just add that if you're not from the New York area and you didn't go to school in the New York area, you didn't rotate at any site, that's when it becomes a little bit more, I think, important for you to somewhere explain in your application or in your personal statement why New York. And people have mentioned ties or support system. I think that's the place to do it if it's not otherwise obvious in your application from where you rotated or where you went to school. Because we'll obviously still, we look at everybody. And if you want to show that you're interested in the area, you gotta enter it somewhere.
All right. Thank you so much for that insight. Um, Question, because we have a lot of IMGs that get connected with us and to these events who are interested in rotating in New York. So if anyone can speak either for your own program or from what and if possible, ideally what you know about, New York programs across the board. How friendly are New York programs to accepting IMG applicants? And what's the best way for IMG applicants to go about getting elective rotations at your programs?
It depends strongly, and I don't want to speak for any of the other programs, but I know at ours it really depends strongly on your GME office, like because we have a lot of residents across the whole institution, and the GME office will often only let you take so many visas, like visa students. So here, so they're not going to necessarily let EM take them all if IM needs them. It just gets spread out across a large variety. I know like in Rochester and Buffalo, who's not here, and I'm assuming probably Syracuse, we end up taking a fair amount of Canadians because they're right there, and I know we get, yeah. So thanks. We ended up taking quite a few of those. I think more international students can be tougher because internal medicine for us gets, takes a lot of those visa spots, so it can be tricky. But that's our situation. It's not that we won't, it's just a matter of number.
Yeah, us in the Bronx, we've taken lots of Canadians. Also, I'm actually Canadian myself, and it's easier with Canada. J1 visas are easier. H1B visas are more complicated and require a lot more time and a lot more legal paperwork. So they make it harder, probably to get and harder to be able to pursue that line. J1's tend to be easier again. And it goes down to pretty much ends up going down to like the countries where people are coming from and how they're going to be related through immigration. So easier countries, a lot of European countries, easy to get. Canadian countries to get. Our GME is pretty open to J1s across the board. We actually have our own immigration lawyer that deals with all that stuff. But H1s pretty much shuts the door on a lot of things.
SUNY Downstate, like us, we also don't offer any H1s, but we do have foreign students, and we do offer J1 visas. I would recommend, just in terms from the application process, that you do a rotation in emergency medicine, ideally in New York City, if you want to, New York area, if you want to apply. I do think that that's challenging because, like us, we don't really control that. That's through our school, and all those applications for the rotation go through our VSAS program. So and which doesn't allow international medical students to apply through. So we don't allow international students, but Kings County has a specific relationship with St. George's, and so we do have St. George's University students rotating through our ED, Kings County alone. And I think that that's going to be the biggest challenge for any international medical student, is finding a place where they can do rotation. There are places in New York that do allow international students, and I think it's just the challenge is finding those places and getting spots in the right time period.
Yeah, I will also plug that if you look up on YouTube, the NYEMSC, we did a Vislo and away rotations event last year, where one of our Caribbean students was talking, our former IMG liaison talked about his experience getting away rotations at New York programs. So there are a couple of questions as well about board performance. I will start with the one that is more germane to MD students. So the question is, how do programs view MD students who needed to take a step exam more than once, as well as how do they view programs who have not, or sorry, students who have not taken step 2 yet?
I guess I would speak a little bit to that. I've been a program director at a number of programs, including some of the programs here this evening. This has been around for a long time. In some ways, moving step 1 to pass fail does not help those students who want to distinguish themselves with a high score, particularly if you're an international graduate. That may be an important score to distinguish you. It's not available anymore. Similarly, if you go pass fail and you fail the first time and then you pass, we don't know if you passed by 2 points or you crushed it the second time. And sometimes it's not so much about failing, it's how did you learn, and how did you bounce back from a failure? What did you learn from that? And life is, I mean, we all have failures. All of us do. And it's really sometimes a measure of character when you can bounce back from it. But pass fail in some ways doesn't really help you. And I'm just going to say maybe the thing that isn't always said because it's kind of a weird, um, I don't know, it's like a I don't know how to describe it really, but on the one hand, the ACGME expects us to graduate people to pass their boards on the first attempt greater than 80%, and our goal is 100%. Well, a standardized test doesn't say what kind of doctor you're going to be. USMLE doesn't measure compassion or empathy or other aspects of professionalism, but it does indicate whether you can handle, the stress of a high stakes examination. And so on the one hand, programs are kind of looking at, well, we want our graduates to pass. And then on the other hand, we want to have a holistic review where we don't put a lot of weight onto a score. And so it's just kind of an odd, weird thing that you're in the middle of. The ACGME seems to, or maybe the ABEM, I guess. No, the ACGME makes it the requirement. So look, if somebody failed, I just look at that holistically with everything else that's going on in their application and what did they learn. I personally like to see a step 2 score before somebody's coming into the program. I mean, I think you have to have that to graduate medical school, but especially with pass fail. And again, I'm just going to be straight up candid. I want to see what someone did on step 2. I need it. I'm not about numbers. And by the way, neither are patients. But you know what? If you have a potassium of 7, you better do something about it. So, I mean, anyway, that's fine.
Yeah, I would definitely echo that. Sometimes I understand why you wouldn't be able to get step 2 taken by the beginning of interview season. Though I'd say most people, it seems like they are able to do that. But if you don't, you can always email your programs that you applied to afterwards and let them know if you hadn't heard from them that you updated your application with that step 2 score. But yeah, if it's not in by the end of interview season, I start to wonder, why haven't I seen that yet by January?
I'll echo what everybody said. The only thing I would add to that is that for us, we will not rank anybody who hasn't passed step 2 by rank day. Just because if you don't pass it, you can't start residency. And frankly, we've been burned in the past. So that's our general rule. I would recommend that you take it ideally before interview season starts, but by the beginning, I think is fine. I think you're okay if by the first day of interview season you haven't taken it yet, but you should be taking it early. And that's just the reality. People want to see that number. And I think a lot of us use holistic review, but they want to see that number.
All right. Thank you for those insights. We have a very similar question that is more relevant to the DOs in the room. So the question is, since COMLEX 1 is now pass-fail, how do you look upon applicants who have passed COMLEX but have not taken STEP?
Don't waste your time.
Sorry. Go for it, Joshua.
Don't waste your time. That's what I think. I don't know if everybody agrees, but I would say don't take 2 tests when 1 is fine.
Well, particularly if you did well. I mean, listen, somebody who takes step 2 COMLEX and they score over 600, 650, no one's going to care about USMLE.
And I feel like over the last few years, it's become a lot less common to see people taking both. In the past, we used to see a lot more. Now people are mainly just sticking with one exam over the other, and it doesn't matter as much.
All right, thank you. All right, now we have one that's a little bit less logistical. So in general, this is more of an open-ended question, but in your mind, what makes or breaks an otherwise competitive applicant?
So everybody here is going to give an answer that I think is pretty similar, and that is we look at the whole application. It's going to be, your slows are going to be very important. Without a doubt, we're all going to read what your experience is in emergency medicine. But then each one of us looks at your life experience, looks at the things you've accomplished, reads your personal statement, and the competitive applicant can excel in a lot of these or one or two of these. And I think that there's never going to be just one thing, it's why making the exam pass fail didn't hurt us very much, because to be honest with you, the exam score shouldn't have been what we were looking at in the first place. We want to get an idea of who the applicant is, whether they're going to fit into our culture, and what sort of an emergency doc they're going to be. And that's really the whole review.
I can comment on some things that can break you. Um, Having a red flag and not explaining it. You're allowed to have a mistake. So, for example, you're allowed to have a pass or a fail. If you have a fail, give me an explanation. Why did you fail? What did you do better next time? Showing up late to an interview, having some unprofessional issues with the coordinators, not replying to emails. You are going to have this process through interview season where you're going to communicate with us, you're going to show up to socials, you're going to talk to our residents, and all of that is part of the process. All of that's going to get back to us, and all of those things can break you. So I think just being in very much keep in mind that all of that is part of the interview process. So I think all of those things can break you along the way.
I'll echo that too. Like if there are issues with your application, things like gaps or professionalism issues or whatever it is, you really want to come out, own it, make it part of the application and the story, because if we find it out or we search it out and then we don't understand it, it's never better.
And just to add on to some of that discussion, like the interactions you have with people other than us can be so important, because like in my program, if I find out you sent a rude email or had a rude conversation with my coordinator, any secretarial staff, I'll tell the rest of my team, like, I don't care how good they are, we're done, we're not talking about this anymore, they're off of our list. So all those little things that don't seem important actually are. Like, remember, you're on a stage, this is a show, you're on 24 hours a day during this time period of your life. Be prepared for it and be professional at all times.
And I'd also just like to add, to be honest, anything that you put on your application is fair game. Like your participation in an extracurricular activity or your hobbies. We may ask about that on the interview. So just know that you might have to speak about it. So be honest about your application.
Kind of echoing the interview process as a holistic component. Remember also the interactions, like someone else just said on the calls, the interactions you have with everybody in the hospital. So if you have a nurse that sings your praises or a PCT that sings your praises and it winds up in a slow, that's hugely positive for you. So just be mindful of that interaction as well. You're not only auditioning with the attendings and the residents and stuff, but you're making an impact and an impression on the nurses that you're eventually going to be working with, and the PCTs you're eventually going to be working with, and certainly the patients that you get to treat on your clerkship as well.
And just to add on to honesty comes the word authenticity. If you're faking it, that's not what people are looking for. You want to have a genuine kind of care for people. There's a book by Danny Meyer, a famous restaurant entrepreneur. It's called Set the Table. And he says in it, he can teach people where to put the wine glass, and he can teach people, where the plate is supposed to go. But he said he can't teach people to be interested in how their actions and behavior affect other people. And then he said, hire right. Because if you're not interested in how your actions and behavior affect other people, it actually probably shouldn't even be in medicine. But it certainly shouldn't be in emergency medicine, where it's all about people and meeting people constantly throughout your shift.
Right. Thank you. That is, appreciate all that insight. And actually, that's a very good lead into the next question. You already kind of answered it. But one of the questions that I had loaded up was what personality traits do you expect applicants to have in order to match at your program? So if anybody wants to add anything else in that domain, please feel free. And I sort of had this lumped in with what helps applicants stand out in their applications. So anyone who wants to sort of answer either of those portions of the question. Okay, great. Um, no, go ahead, Dr. Pereira. Did you unmute?
I mean, I think everybody's being polite here, which is probably good. Bottom line is that if you are passionate about anything, make that stand out in your application. There's not one magic bullet to being the best emergency doc out there. For me, I look for people who have throughout their life, college, medical school, gotten involved with organizations and things that help other people because so much of my satisfaction in my job comes from helping other people that's one of the things I look for. But I do think that everybody looks for something a little different. And what you need to do is not try to sell yourself to what you think we will want, but rather just put yourself out there and you're going to find that there are a lot of other emergency docs who respond to the things you're passionate with. And if you tell us who you are, that's the best way to sell yourself.
Yeah, I agree with Dr.
Really,
Pereira on
really
that.
well said.
Oh, sorry, go ahead.
I'm sorry, just that's really well said about what I meant by authentic, because to be yourself, yeah, and every, program will have its culture. In particular, some things are going to be emphasized more than others, but I don't know, someone said something that no one could be a better version of yourself than yourself, or some, I don't remember how the phrase goes, but it's something like that. I'm sorry, you go ahead.
No, I was just going to say, every program has its own culture you're thinking is looking for, something, but every person who interviews you is also kind of looking for their own thing. So you'll never be able to guess it. And so that's why I echo what Dr. Pereira had said, just kind of to be your authentic self.
All right. Thank you all once again for all of your insights. We had a question about couples matching. So the question was, do you have, actually, I think I combined a couple. Do you have any advice for couples match applicants who are applying to your program or programs throughout New York? And then advice for those who are trying to sort of stand out as individuals while sort of involving their partners. So what's your best advice for navigating that process?
It's going to be a little bit of an unknown this year with the transfer to what is it, ResCast? Because I think it depends on whether like if you're couples matching with someone who's using the old system, it's going to be a little tricky. You're going to really need to signal on your application that you are couples matching, and I'm not completely sure how it's going to work this year. It's going to be a little tougher, I think, for those applicants. So just be aware of that.
I think you can still couples match through the NRMP. I think
Yeah. I just meant like it's going to be harder to signal it, I feel like. I don't know.
I guess the question is if you're both applying for emergency medicine or one is applying for emergency medicine for the other. I think the good thing is that you're in New York, and this is not even all the programs in New York. So that leaves a lot of options. If you're applying in New York and you want to do couples match, it kind of makes sense. It makes life a little bit easier. And I think it's always a challenge, couples match, because you have a partner you want to think of it. And if you're talking about a couple who are both interested in emergency medicine, that presents its own separate challenge because you obviously want to be near each other. You're also kind of competing with each other. Our program in the past had a kind of policy of avoiding taking couples for fear of the fallout in case that couple uncouples. But in the past several years, we've actually taken several couples and have not had any uncoupling. So it's worked out okay. But I think that there's challenges, but I think New York is a great place to be able to do it.
I am always amazed at how well couples matching works, and how people end up where they are supposed to be. We love when we get a couple, because I think being with your loved one makes you happier, and happier residents are great.
All right. Perfect. Thank you so much. I think we will close with this one's a little more open-ended as well. What's the most common misconception you see from medical students who are thinking about going into EM? So anybody who would like to, I think this is going to be our last question for the night.
It's interesting because this actually came up at one of our like residency meetings recently because we were talking a little bit about how I think some people go into emergency medicine because they think they want to go into like the TV show The Pit, and that it's not helping us to actually like show what emergency medicine is really like, which is more like 75% of the time you're kind of working in an urgent care, and then like 20% of the time it's actually like kind of interesting, then 5% of the time it's like very crazy and utterly off the wall. And so I think that there's a lot more. I think a lot of our residents sometimes are surprised by like the a little bit of the monotony of some of it, which is just like it does have like a rhythm to it, punctuated by a lot of like craziness. And so I think like what people should know going into it is like there is a level of this that is just, helping out the common people sort out common problems, and not all, the crazy stuff we like to talk about. And so, you really get into it because you want to just kind of be there when people just have basic questions, or be there when people just need help of whatever kind. And it's not necessarily going to be super glamorous most of the time. So that's kind of what I've noticed occasionally.
I love
Phil.
emergency medicine. I've been doing it for over 40 years. I'm still working shifts. I love what I do, but it's got to be something that you love. And I think part of the prevention of burnout is to make sure you understand what emergency medicine is all about and you're built for it. And I'm just being straight up about this. I think of like, if you ever see those bridges that are like, it says, don't drive over this with like a 6-ton car or something, like a vehicle, like the bridge is only built for 2 tons or something. Well, I feel like emergency medicine is like a 10-ton 18-wheeler, and it's coming over me sometimes, and I'm built for it. And I feel very fortunate for that. I wasn't built for basketball. I'm only 5'8" and getting shorter every day. But I really love what I do. And it's not like the greatest lifestyle. It's 24 hours a day. I mean, yes, you can take shifts and, push them off and, have time off and when you're not on call. But I mean, it is a tough lifestyle. It's days, nights, evenings, weekends. You got to be built for this. It's going to challenge you emotionally, physically, mentally, intellectually, on every level. You got to take care of yourself if you want to be in here for the long haul. But I just get to understand what it really is about. It's social justice. It's about taking care of people in their hour of need. It's about caring for people, having a heart for people, not judging them, not going like really caring for like the people who I mean, I just don't even know how to, I don't have enough time to say it all, but I mean, you've got to know, my mission is to provide the finest quality care and having each and every person leave with an experience of value. You don't even hear emergency medicine in there, but it is in there. It's about honoring people. So that's what I have to.
I think just to piggyback off that a little bit, I think some people want to go into emergency medicine to save lives, and I have a very short list of the number of lives that I've saved in the last 20 years, and those are great, but I get to help people every single day. So you have to be ready to help people without the expectation of that awesomeness, that awesome feeling. It's a great feeling to do some of those amazing things. But it's also an amazing feeling to be able to tell somebody they're not having a heart attack because they're having musculoskeletal chest pain and see the relief on their face. So, and I get to do that every day.
And we've all had those big moments. And you know what? I still like doing a blood gas. I got to do that a couple of months ago. I was like, yeah, I did a blood gas. And the respiratory tech couldn't do it. It was like, I have those moments. Still 40 years later, I still have those moments. But it is so much more than that. It's not just procedures. There are intubations, and there's times I think I did an amazing job with that, or I had made an aortic dissection and the person walked out of the hospital. But most of the days, it's like they were just saying, it's just helping people.
All right. Thank you all. I think that that is a fantastic note to close on. Thank you everyone for coming. Thank you so much to our panelists for giving us their time and telling us, about what makes their programs great and giving us all these insights. I hope that all of the attendees, especially the M4s, such as myself, for applying, I hope you breathed a little bit of sigh of relief at some of those answers. I hope some anxieties were a little bit, quelled. And thank you to my board for helping me put this all together and make this happen. And of course, thank you to the attendees for coming and submitting your questions. And if you liked tonight, we have more events that we will be running throughout the year. The next thing that we are doing will most likely be an advocacy and public policy event that will be run by Garrett and Brian, our public policy and advocacy directors. That'll probably have a little bit of a social EM flavor. We're still finalizing the details for that, but stay tuned. Follow us on Instagram. Keep in touch with us, and you will get all the information about those. Once again, thank you so much. This recording will be uploaded. You'll get a link if you attended tonight, and the slides will be sent out as well. And if anybody has questions, feel free to reach out. To my board, did I miss anything?
You got it all.
Sounds good.
Great.
All right. All right. Thank you, everybody. Have a wonderful night.
Thank you, Brendan.
Thank you all.
Thank you.
Thank you.